There was something a patient said to me not long ago that stayed with me longer than most conversations do. He was in his mid-70s, relatively active, living independently, and overall doing quite well. He came in not because he felt unwell, but because he had been scheduled for a series of routine screening tests. Everything sounded responsible, preventive, the kind of care we've all been taught to trust. But what struck me wasn't the tests themselves. It was how automatic the entire process felt. No real discussion. No deeper questions, just a sequence of steps that had been set in motion without anyone stopping to ask whether those steps still made sense for him at his stage of life. And this is something I see more often than people realize. After 70, the conversation around health should change, but in many cases, it doesn't. The system continues to operate the same way it did when you were 50 or 60, even though your body, your priorities, and your risks are different now. And that's where problems begin. Not because the intention is wrong, but because the approach doesn't adapt. Today, I want to walk you through something that most people are never clearly told. That some routine screening tests, especially after 70, may lead you down a path that becomes more complicated than helpful. Not because the tests are bad on their own, but because of what often comes next once something is found. There was something a patient said to me not long ago that stayed with me longer than most conversations do. He was in his mid-70s, relatively active, living independently, and overall doing quite well. He came in not because he felt unwell, but because he had been scheduled for a series of routine screening tests. Everything sounded responsible, preventive, the kind of care we've all been taught to trust. But what struck me wasn't the tests themselves. It was how automatic the entire process felt. No real discussion, no deeper questions. Just a sequence of steps that had been set in motion without anyone stopping to ask whether those steps still made sense for him at his stage of life. And this is something I see more often than people realize. After 70, the conversation around health should change, but in many cases, it doesn't. The system continues to operate the same way it did when you were 50 or 60, even though your body, your priorities, and your risks are different now. And that's where problems begin. Not because the intention is wrong, but because the approach doesn't adapt. Today, I want to walk you through something that most people are never clearly told. That some routine screening tests, especially after 70, may lead you down a path that becomes more complicated than helpful. Not because the tests are bad on their own, but because of what often comes next once something is found. Now let's talk about the first screening that often falls into this category: routine colonoscopy after 75. For many years, colonoscopy has been strongly recommended as a preventive measure, and for good reason. It can detect changes early and allow for intervention before problems develop. But after a certain age, especially if previous screenings have been normal, the benefit begins to decrease. At the same time, the process itself becomes more demanding on the body. Preparation alone can be challenging, requiring significant fluid shifts that may leave you feeling depleted. The procedure typically involves sedation, which your body processes differently as you get older. And while complications are not common, they do happen, and recovery can take longer than expected. The key question becomes not just, can this test find something, but will finding something actually improve your quality of life? For many people in their late 70s or 80s, the answer is not always as clear as it once was. This is why guidelines increasingly suggest a more individualized approach rather than routine continuation. It's not about avoiding care. It's about making sure the care you receive is truly aligned with what benefits you most at this stage of life. The next area that often creates more questions than answers after 70 is cancer screening, particularly for breast and prostate health. These screenings have been deeply ingrained in preventive care for decades, and for many years they have played an important role. But as you get older, the context changes in ways that are not always clearly explained. What tends to happen is that screenings begin to detect conditions that develop very slowly, changes that may never actually interfere with your day-to-day life. However, once something is identified, it rarely stops there. It leads to additional testing, follow-ups, and often treatment decisions that can be physically and emotionally demanding. For women, routine breast screening later in life may uncover findings that require further evaluation, sometimes leading to procedures that take time to recover from and can affect independence during that recovery period. For men, prostate screening can reveal changes that are extremely common with age and often remain stable for years without causing issues. The challenge is that once these findings are on record, they tend to lead to a series of decisions that may not always align with what truly benefits you long-term. This doesn't mean these screenings are never appropriate. It means the decision should be thoughtful, based on your overall health, your daily functioning, and your priorities, not just routine. Another situation that often follows a similar pattern is routine cardiac stress testing in people who are not experiencing any symptoms. This is something that happens more often than many realize. A test is ordered just to be safe, and on the surface, that sounds reasonable. But what's important to understand is that these tests are very sensitive, and they can pick up small variations that may not actually represent a serious problem. Once something unusual appears, even if it's unclear, it often leads to further investigation, additional imaging, more detailed procedures, and sometimes interventions that carry their own risks. The process becomes a chain reaction, and here's where it becomes important. For individuals without symptoms, these findings do not always translate into improved outcomes when acted upon. In fact, in many cases, managing overall health through lifestyle and appropriate medical care can be just as effective without introducing unnecessary procedures. The difficulty is that once the process starts, it can feel like there is no easy way to step back. That's why the decision to begin with testing in the first place deserves careful consideration, especially when there are no clear symptoms guiding that decision. Bone density screening is another area where the conversation becomes more complex with age. The goal of these scans is to identify reduced bone strength and prevent fractures, which is certainly important. However, the way this information is used can sometimes lead to decisions that don't fully account for the bigger picture. Bone strength is only one part of the equation when it comes to falls and injuries. Balance, muscle strength, medication effects, and overall mobility often play an even greater role. When a scan shows lower bone density, the next step is often medication. While these treatments can be helpful in certain cases, they also come with considerations that may not be ideal for everyone, especially as age increases. The focus, in many cases, shifts toward managing a number on a scan rather than addressing the broader factors that actually influence daily safety and independence. For many people over 70 or 80, improving strength, stability, and home safety may have a more meaningful impact than focusing solely on bone density itself. This is where a more balanced conversation becomes important, one that looks beyond the scan and considers how you actually live day to day. The final screening I want to mention is carotid artery screening, which looks for narrowing in the blood vessels that supply the brain. At first glance, this seems like a very logical preventive step. The idea is to identify potential issues before they cause problems. However, in people who are not experiencing symptoms, the situation is more complicated than it appears. These screenings can detect changes that are present but not actively causing any issues. And once those changes are found, they often lead to discussions about procedures or interventions. The challenge is that, in many cases, managing overall health with appropriate medical care and lifestyle adjustments may be just as effective as intervening directly, especially when no symptoms are present. But once something is identified, it becomes difficult to leave it alone. The process moves forward, and for many people, that process introduces risks that may not have been necessary in the first place. This is why many guidelines recommend a more selective approach rather than routine screening in individuals without symptoms. It's not about ignoring health. It's about making sure that the actions taken truly serve your well-being. Now, at this point, a very natural question comes up. If some of these screenings may not always be beneficial after a certain age, then why are they still being recommended so often? And the answer is not simple, but it is important to understand. The medical system is designed around prevention, early detection, and action. Doctors are trained to identify potential problems and address them as early as possible. That approach has saved countless lives, and it remains incredibly valuable. But the system itself does not always adjust smoothly to the realities of aging. It often continues to apply the same logic across all age groups, even when the balance between benefit and risk begins to shift. There are also practical factors involved. Guidelines can vary, and not every situation is clear-cut. Time during appointments is limited, which makes it easier to follow standard protocols rather than have deeper, individualized discussions. And in some cases, there is a natural tendency to do more rather than less, simply because doing something feels safer than doing nothing. From a patient's perspective, more testing often feels like more care. But as you've seen, that is not always how it works, especially later in life. Understanding this helps you see that these recommendations are not about anyone doing something wrong. They are about a system that does not always fully adapt to individual circumstances. So the question becomes, what can you do about it? The most important step is to stay engaged in your own care. When a test is recommended, instead of immediately agreeing, take a moment to ask a few simple but powerful questions. What exactly are we looking for? If something is found, what would the next steps be? How likely is it that this finding would actually affect my quality of life? And what are the risks of the follow-up procedures? These questions do not challenge your doctor. They support a better conversation. A good physician will welcome this discussion because it allows decisions to be made based on your specific situation rather than general guidelines. It also helps clarify whether the test is truly necessary or simply routine. In many cases, just having this conversation can change the direction of care in a way that feels more appropriate and more aligned with your goals. Another important shift is how you define good care at this stage of life. For many years, good care has been associated with finding and fixing every possible issue. But after 70, the focus often becomes different. It becomes about maintaining independence, preserving energy, and supporting the quality of your daily life. That may mean being more selective about which tests you agree to and which ones you choose to decline. It may mean focusing more on how you feel day to day, rather than what might be found on a scan. And it may mean prioritizing stability over intervention. This is not about doing less. It's about doing what actually matters most for you. And that shift, while subtle, can make a significant difference in how your healthcare experience feels over time. So here's what I would recommend. The next time a routine screening test is suggested, pause for a moment. Not to refuse it automatically, but to understand it more clearly. Ask what the purpose is. Ask what happens next if something is found. Ask whether this test is likely to help you feel better, function better, or live in a way that matters to you. Because after 70, the goal is not to find every possible problem. The goal is to support a life that feels stable, comfortable, and meaningful. And the decisions you make about your care play a direct role in that. If this gave you a different perspective, take a moment to reflect on your own approach to health decisions. And if you know someone who might benefit from hearing this, share it with them. Sometimes, the most important part of care is understanding when to move forward and when to pause and think. Take care of yourself, and I'll see you in the next video.